reaching out to all our constituents. Grounded in a vision that everyone should have an opportunity to live a healthy life, NYAM generates knowledge to inform policy and programs, works collaboratively with local partners on community-driven solutions, and engages the public to achieve its mission to drive progress towards health equity. To learn more about our work and upcoming program, please visit nyam.org. Dr. Elaine Congress moderates this evening's programs. Among her many roles that were noted in the program bio, Dr. Congress is Associate Dean and Professor at Fordham University's Graduate School of Social Service, and along with Dr. Patricia Kolb, is the co-chair of NYAM's section on social work. Before turning the podium over to Dr. Congress, who will introduce tonight's panelists, this webinar will be recorded and available for those who have been unable to participate. We encourage everyone to ask questions of our panelists by placing your questions in the Q&A box. Questions will be addressed following all of the panelists' presentations. We hope you enjoy tonight's program, and I am pleased to turn the podium over to Dr. Congress.
Okay, thank you very much, Donna, and I'm very excited to be here and to be moderating this program on public health at the Crossroads, the roles for social workers, because this is something I'm very concerned about, and we all are in our section. And I think you met briefly my co-chair Pat Cole from Lehman, and we have other people on our executive committee, Allison Snow from Mount Sinai, and Barbara Silverstone from the Helen Rear Center. So we're real pleased to be here and to be working with NYAM and putting on this very exciting program. I'm going to begin with a tribute to Dr. Barbara Brenner, who was going to be part of our program, who's really brought public health to the social work to the foreground at our institute, but unfortunately she's no longer with us. So I'm going to just take a few minutes to just talk about her. Barbara I knew very well. I'm going to talk about three main areas. I'm going to talk about through NASW, National Association of Social Workers. I'm going to talk about at Mount Sinai. And third, last but certainly not least, I'm going to talk about her role at NYAM. First, in terms of NASW, I first met her when I was president of NASW because she had been a previous president and really had brought health into the social works arena. She organized a health committee for NASW. She developed many programs and really made us think more about health and health equity issues through NASW. Then second, just in terms of Mount Sinai, she was for 40 years at Mount Sinai and really had a big role. How often does the president of a major hospital write like a tribute to a person who's departed? I mean, but he did. It was just incredible. She really brought people's attention to East Harlem, because as she said, I mean, Mount Sinai borders on East Harlem. They can't kind of ignore the neighborhood to the north. So she was a director of community relations with, at East Harlem. She really helped a lot of people, bring a lot of social work skill and public health knowledge and skills into working with the population. One of my first meetings with her, she'd asked me if I could help find a Latino student to help in signing up, older Spanish-speaking only, clients to sign them up for Medicare. So she was just incredible. And now the third thing I want to talk about is her contribution to our social work section. We weren't always a section. I mean, as you can imagine, just with the title, we're very kind of medically dominated. And so all the, they're all the medical specializations were sections. But we know that we're an important part of the kind of the healthcare team. So she really promoted that we should also be a section. And it was under her that we were able to establish our first section, first social work section at NYAM, and she became our chair. And it wasn't just a position to something she put on her CV or resume. She was very active, had a lot of meetings about kind of Medicare, Medicaid program, managed care program, and brought leaders, major leaders, federal, statewide and local leaders to talk to educate social workers about managed care and what it would mean for us. So these are three of the main activities she was involved with, and she'll really be missed. She is missed, but I mean, I think her legacy, lives on in terms of public health social work. So I really want to kind of dedicate tonight's program to her. Now, I'd like to talk about our two main speakers for today. And both of them are very involved in public health social work. And first, I'd like to introduce Dean Melissa Begg. Dean Begg is a dean at Columbia School of Social Work, which is my alma mater for my master's. And she describes herself as a population health specialist. She has over 30 years experience. She's worked as a vice provost in the program for academic progress. She is for many NIMH funded projects. And what I especially like and admire about her is she really focuses on interdisciplinary work. Of us all working together in public health and social work, in medical fields, nursing, all those different fields, and bringing them together. And I think this is so important. So she's going to tell us a bit about public health and social work and how she sees them integrated. So without further ado, let me turn the program over to Dean Begg.
Thanks for that nice introduction, Elaine. I'm really grateful for this opportunity to be with you today. And as you said, I have the great honor of serving as the Dean of the Columbia School of Social Work, and our mission is centered on social justice with the goal of maximizing human well-being and ensuring that everyone can reach their full potential. Also, as Elaine said, I've been a population health scientist for 33 years and counting, not done, and I'm a proud member of the social work community. But my career didn't start in social work. It started in public health. So the issue of the commonalities and distinctions and the potential synergies between these two fields is very real to me. Now, I learned a great deal over my 25 years in public health. But the most important lesson I think that I gleaned was this, that much of human suffering is manufactured. It's created by the policies and structures that we put in place. But if we created them, then we can fix them. So with this recognition, I've been inexorably drawn to social work because social work practitioners and researchers commit themselves to eradicating injustice, rectifying systemic inequities, combating racism, and promoting full and fair access to opportunity across all strata of society. And there is so much work to do. So I'm going to share a few thoughts. I'll start some slides in a second here, but please take with a grain of salt my evolving opinions on this. And you may disagree with a lot of what I say. I'll be talking in broad strokes because we don't have all that much time. And if you disagree, I say, please push back. I want to hear your thoughts. And I want to hear where we agree, especially where we don't agree. And so can speak up here in the Q&A, or feel free to send me an email later. I think the important thing is to keep this conversation going. So with that, let me start to share my slides, which I hope I can do without too much trouble. All right, are folks able to see that?
Yes.
Okay, good. Thank you. So, so this image, as a preamble to what I'm going to say, let me emphasize this term crossroads. I really like the fact that you chose that word, Elaine, for you and Pat as a linchpin here. And as I thought about crossroads, I came to other terms in my head like forks in the road or the road less taken. And I think that the story here, there's a story here of many forks in the road and decision points that lead to one direction or another for the fields of social work and public health. And I'll just say that reminded me of an incident from my childhood. I was wandering around the farm where my father was born. And my brothers and I got lost, and we happened upon a farmer and asked him for directions. And he came back with this very memorable response: when you come to the fork in the road, go straight. And I think that captures a lot. And I think there might be a lesson in there for us on where we go with these two disciplines. So I'm going to start at the beginning, and I'll just do some to first principles, start with definitions and a little bit of history on public health and social work. And please take note, I'm talking mostly about the fields of social work and public health broadly, not the specific subfield of public health social work, although that touches on that too. But so let's get underway. So here, here's the definition on the left side, a couple of definitions of public health. And I think we're all familiar with the IOM definition. It's what we do collectively to assure the conditions under which people can be healthy. And CDC Foundation expounds on that. How? By promoting healthy lifestyles, researching disease and injury prevention, and detecting, preventing, and responding to infectious diseases. And next to this, I've placed this definition of social work from the International Federation of Social Workers. This is my favorite one. It lists social work as a practice-based profession and an academic discipline that promotes social change and development, social cohesion, and the empowerment and liberation of people. And it does that by engaging people and structures to address life challenges and enhance well-being. So I really like that one. And I think as you look at these definitions, there are two central ideas here coming through very clearly. One is health, one is well-being. Both are important, and they're not quite the same. So in trying to think about what that means for us, I came across this graphic that I think is helpful. When I think of health initially, I tend to think of physical health and mental health, and you can see those within this little chart here. Well-being is somewhat broader and kind of harder to pin down. The CDC, if you go to their website, spends like almost a page trying to define it. But I think what they eventually come out with is it's well-being means feeling good, functioning well, having a state of happiness and a sense of purpose and accomplishment, having positive relationships, and overall having the ability to thrive. And so I think that sets us up well for the following recognition, and that is that well-being goes beyond health. Is a person able to thrive and meet their full potential? So now we're talking about a whole host of other things like social relationships and education and housing and the environment and economic opportunity and employment and freedom from oppression. And as a social work dean, I can tell you that social work faculty are working on some of the most pressing challenges of our time, the kinds of things you read about in the paper every day, like poverty and economic mobility, racism, opioid use, immigration regulations, child and family support, mental health and trauma, and technology's impact on society, to name just a few. And just to bear in mind that all of those things, all of those phenomena exert tremendous influence over well-being. So if public health and social work are concerned with health and overall well-being, what do they have in common and where do they diverge? So as you all know, both professions became prominent with the advent of industrialization and urbanization and immigration, responding to the needs of individuals and populations experiencing poverty and at times really miserable living conditions. Now, by the start of the 20th century, public health and social work were pretty well integrated. For example, professionals from both fields joined together to address the challenges of maternal and child health, also responding to the 1918 pandemic, responding to the Great Depression. So that partnership around maternal and child health resulted in tremendous gains. The infant mortality rate dropped by half during that period. And that was through combining prevention efforts and education with legislative advocacy. So what a great beginning, right? And then, of course, there's always crossroads, a fork on the road, some obstacle you need to navigate, and decisions get made and directions can change, right? So building on that example of maternal and child health and the reduction in infant mortality, that seemed like a great beginning, but then further legislation failed. Why? Because the American Medical Association, for one, and certain business groups opposed it. Why? Too socialist, all right? And so like Harry Truman once said of a certain number of his esteemed colleagues, socialism is their name for almost anything that helps all the people. All right, so now you have a little more of a split. The professions continue to evolve. Both were rooted in social justice at the start, but they continue to evolve. Let me talk about social work first. Social work has always espoused social justice at its core. And as it continued to grow, in the words of Betty Ruth and colleagues, it developed a dual heartbeat. I really like that term. It's the micro approach of clinical casework, meeting the social and psychological needs of individuals and families, and then the community or macro work, focused primarily on structural reforms and social change. Now, at the same time, the science behind medicine and public health kind of exploded, profoundly influenced by Pasteur's discovery that microbes can cause disease. So what happened? Medicine sort of became the science practice of caring for a patient, and public health turned its focus mostly on prevention and developing really rigorous methods for identifying and testing individual factors that could either increase or decrease the risk of disease. So Betty Ruth and colleagues had a great term, and this simplifies it. It maybe oversimplifies it, but I think it gives us a framing. Medicine now is focusing on treating disease, public health is focusing on preventing disease, and social work is focusing on the social side of illness, the social causes and consequences of disease. So while public health and social work started in this social justice framing and shared a common interest at the start in the social determinants of health and well-being, I'm going to posit that social work maintained this focus much more steadily and insistently than public health did. And great things were going on in public health too. They started down the highly analytical pathway, and that led to great methods and results, but was something lost in that fork in the road. And that kind of stayed the case until the 1970s, when social determinants were brought to the fore again in the public health arena by a number of authors. And that sort of reignited interest in this. And that leads me to this image. This image is based on a truly wonderful quote, I think, from Desmond Tutu. There comes a point where we need to stop just pulling people out of the river. We need to go upstream and find out why they're falling in. Right. So I think I discovered this person on Twitter, Juliet Young. I believe she's a psychologist in the United Kingdom, and she has a tremendous ability to draw and generate cartoons. And I love this cartoon. I think it really captures the social determinants of health. So you've got that bridge there and people trying to cross it. And what is that bridge? It represents health systems and laws and educational system and racism and social policies, et cetera, et cetera. It also nicely captures social relationships, right? People can help you get across the bridge, but some people fall in. And then we have to take steps to figure out a pathway back. So to my mind, this image represents the way that so many things influence well-being and the havoc that's wrought by the lack of social relationships and lack of social supports and the lack of a viable social safety net. And I think this is really very motivating. So there's a paper that Graham published in Millbank Quarterly that also captures another aspect of this. Graham points out that there are social factors that promote or inhibit health, and that's what you see on the left side of the screen. And there are social systems that dictate the unequal distribution of those factors across society. And that's what you see on the right side. I think that's a really great reminder that while we must promote health, we must at the same time promote health equity. And that might require different steps. And I think that pushes us back to a reliance on the roots of both professions. And in the words of William Beveridge back in 1942, health and social welfare are one. All right, so if they're one, how do we act on that? And what do we do next? What do we need to do to be effective in focusing on what really matters for well-being? Now, the challenges we face are really hard, and many, including me, believe that interdisciplinary collaboration, Elaine, thanks for mentioning that earlier, I think that's the only way we're going to make headway against them. All right. So this is another example, I think, of this great phrase, it will take a village. All right. Let's recognize that, to quote Karl Popper, we're not students of subject matter, but students of problems, and problems cut right across the edges of all the disciplines. And this was recognized by Elias Zerhouni, former head of NIH, back in 2003 when he launched the NIH Roadmap Initiative. It's also, incidentally, the year that NIH put out their plan for social work research. Okay, all of this emphasizes interdisciplinary work. Why? Because the mountain was too high and too steep for anybody to scale alone. And in her wonderful history of interdisciplinarity, Julie Thompson-Klein gives 5 reasons for interdisciplinary research. Number 1, to answer complex questions, like we're trying to do. Number 2, to address broad issues, check. Number 3, to explore disciplinary and professional relations, very apropos of what we're talking about here. Solve problems that are beyond the scope of any one discipline. And finally, to achieve unity of knowledge. right? So sounds good. We want to do interdisciplinary, but what does it really mean? So again, just want to take a step back and we get a little help from Patricia Rosenfield and this analogy of fruit. So I saw this use of fruit to describe monodisciplinary, multidisciplinary, interdisciplinary, transdisciplinary a long time ago. I can't remember who it was who presented it this way, but I give you honor since I can't remember your name in spirit. So, you know, when you think about monodisciplinary research, that's sort of like a plate of the apples, all right? When you think about multidisciplinary research, now we've got multiple fruits sort of all lined up next to each other. So this is when researchers work in parallel or sequentially from their disciplinary bases to address a common problem, but they're all doing it from their separate cubicles, their separate offices, and then sort of joining together at the end. Interdisciplinary has a different feeling to it. This is where the fruit salad comes in. All right, so interdisciplinary is where we all sit around the table. We're not sitting around in separate offices. We're generating together what are the research questions and what are the research approaches that we want to apply to a particular problem. And then finally, one more image of a fruit smoothie. This is transdisciplinary. This is when we work together so intently and effectively that we've actually developed a shared conceptual framework that draws together concepts and theories and approaches from all the parent disciplines. Some people describe this as sort of one step short of creating a brand new discipline. All right. So lots of research has been conducted on the impact of interdisciplinary research. Is it really better? It's hard to prove that definitively, but I think a number of people have taken a run at it and shown that interdisciplinary research certainly has greater reach, it has greater citation rates, and probably greater influence as a result. So that's great. Let's do interdisciplinary work in order to address these challenges that we face. Well, inevitably, there are going to be obstacles in the road. What gets in the way of interdisciplinary work, whether it's between social workers in public health, or any other disciplines that need to be at the table? Well, for the first part, I think we're really not prepared as academics for roles on interdisciplinary teams through conventional training programs, and that must change, and it's starting to. And secondly, academia, at least the way we've all come up through the educational system, it's set up in these silos of departments, making it hard to cross disciplinary boundaries. And in Klein's words, the tree of knowledge has become magnificently brachiated. Beautiful sentence. What she's really saying there is it's because there's so much going on and so much knowledge generation, it's harder to find colleagues, to find common ground, to identify shared interests, and to make connections. So how do we get around that? What can bring us together? So many authors note that big world events tend to promote and accelerate interdisciplinary collaboration. Events like the 1918 pandemic, wars, worldwide economic downturns like the Great Depression, the Civil Rights Movement, and so on. So I'm going to pause there. Think we've had any big world events lately? I think so. There's so much to say, right? So I'm going to go back to a little inspiration here. Where do we go next, and how do we move forward? Jamel Bowie in the New York Times said, today's disparities in health flow directly from yesterday's disparities in wealth and opportunity. That's a clarion call for all of us to really focus together on the social determinants of health together. Today, race and zip code determine life expectancy. That shouldn't be the case, but they do. Furthermore, the pandemics of COVID-19, anti-Black racism, anti-Asian discrimination, anti-Semitism, and so many other forms of oppression have only served to highlight the inequities that we live with. And while it's painful to have to face those inequities, it's also important that we stare these realities in the face. It's generating a desire for change. Change is possible, and we can do it. And I say we have the models and we have the motivation. So let's think what I mean by that. So think of the great examples over the last 125 years of things that social work and public health have been able to do together. All right, I mentioned some of them earlier during this brief discussion. In addition, I would draw your attention to a special issue of the American Journal of Public Health from 2017, which was guest edited by Sally Bachman. It was called Social Work and Public Health, Charting the Course for Innovation. There is some great content in there and some really concrete suggestions for how we can move forward together. Right. I think there are also some terrific current examples of how people are moving together forward with both social work and public health input. And I'd like to share just a couple of examples from my experiences here with colleagues at Columbia. One example is the Healing Community Study, which is taking on the opioid epidemic. It represents a model, I think, for community engagement, recognizing that communities must partner in driving towards solutions that will work for them. And it unites public health research approaches with social work's, I think, unique talent for community partnership in a very powerful way. A second example project is the Confronting COVID-19 Loss in Harlem. This project leverages evidence-based treatments for prolonged grief, digital tools for treating grief, and community knowledge and networks by setting up a network of Harlem community leaders to help work together to deploy approaches that are needed and effective. And I think it's another great example that technology and data can be used for public good, and that data can be a tool for social justice. I'm also really excited about the Maternal Health in the Fourth Trimester project. And that's a collaboration between social work, public health, and law at Columbia. And it's using multi-state survey data to evaluate maternal health outcomes for low-income women in the year following childbirth, with a view to informing and improving Medicaid policies. So I think there are good examples and models out there. So now moving to the second half of the slide, which talks about motivation. I don't think I need to convince you that we need to work together, but let me just say this. There are so many pressing needs of this moment. And some of our colleagues are already joining together to address them. And the COVID-19 pandemic has shown a bright light on the inequities in our society, and it's our obligation to eliminate them, again, together. I think another opportunity arises with Biden's plans to address the nation's mental health needs, definitely of shared concern to both social work and public health alike. Another opportunity is the grand challenges for social work. All of the grand challenges, if you read all 13 of them, I think they present wonderful opportunities for collaboration because all of those challenges resonate very strongly in both fields. And then finally, I want to point to a terrific piece in the New England Journal of Medicine published by Mary Bassett and Sandra Galea. And they note that racial health disparities, which necessarily result in disparities of well-being, cannot be eradicated without eliminating structural racism. Hence, they make an argument for reparations as a structural response that would ultimately save lives and promote well-being for all. So from where I sit, there's momentum and we can build on it. When we come to the fork in the road where we might split off, let's forge a new path together. And that means we're going to have to be pretty frank and acknowledge and cross disciplinary boundaries more readily. We're going to have to overcome the many structural obstacles to interdisciplinary work in the academy. I think we're going to have to guard against the temptation to see this as a turf war. And we have to stop the either or thinking that leads to one fork or another. So specifically, I think we need to present a lot more regularly at one another's national meetings. And I want to give sincere thanks to those of you who've been doing that work for years. And I want to push for and collaborate on more NIH, RFAs, and program announcements. I think we should also further develop training programs with cross-curricular content and immersive collaboration experiences so that the next generation will be ready. So as I wrap up, I wanted to share some of the references that I found kind of inspiring as I was thinking about talking with you today. And I'll close with this. I was asked to speak this past summer at a session entitled What We Owe One Another. And I love the title of that session because it points to the fundamental truth that we are all in this together. And a failure to recognize our collective responsibility will condemn us to prolonging and deepening inequities. Whereas a recognition of the power of collective action can lead to profound changes in well-being, especially among the most vulnerable. That means we're going to have to operate at both micro and macro levels in the long term with colleagues across disciplines. So I look forward to the next speaker and the conversation we're going to have, and thank you.
Oh, thank you. That was very inspirational and very interesting. It really shows how we're very connected, social work and public health. And in fact, that being happy to have involved with the American Public Health Association, the social work section, and that's exactly one of the areas where social work and public health, connect. And our conference will be in just a couple of weeks, so I think that's a way to do it. I mean, the world's problems are such that as individual professions, as individual people, as individual professions, we can't resolve it all. We really have to partner with others. And improving health and well-being is such a major undertaking. We really need all forces to be involved. So we're doing our part, all of us here. We're here today in kind of connecting public health and social work. So thanks very much, and please put whatever questions you have in the question and answer, because we hope to come to return to some questions later in the program for Dean Day. Now I want to turn the program over to Nicholas Yip. Nicholas is a graduate of Fordham MSW MPH program. We have a master's in public, of course we have a master's in social work program, but we have a master's in public health program with Mount Sinai. And so students take both degrees, you complete both degrees. And Nicholas is one of our terrific students who was a graduate from both programs, really almost simultaneously. And also I think he was a student representative at American Public Health Association. And presented a poster. So he's really been kind of combining social work and public health in a lot of ways. And he continues to do that. Now, Nicholas works at Mount Sinai, and he really works on bringing kind of behavioral, that's where he really combines his work in terms of clinical social work, in terms of health administration, in terms of public health. And his title is the manager of the behavioral health programs. And he really spends his time kind of really connecting behavioral health in terms of primary care settings. It's difficult enough to keep him busy. He's also the director of operations for Strangers Sports Organization. You may say, what is this? Strangers Sports Organization. This is something that focuses on the health needs of kind of youth in kind of neighborhoods with more limited resources, such as in Chinatown. So this is to involve them in sports program. So this is another activity that he's involved with. So without further ado, I'm going to turn the program over to Nicholas to tell us how you can really combine public health and social work, in our field in social work. So Nicholas, the program's yours.
Thank you so much, Dr. Congress. It's a pleasure to be here, and I really appreciate the very generous introduction. So again, my name is Nicholas. I identify as a public health social worker. I'm gonna start sharing my screen. Hopefully you guys can all see that. Alrighty. So yeah, a little bit about myself again. A public health social worker working at Mount Sinai. And I'm here to talk to you about what public health or what social work can be with a public health lens. So my goals here today are to connect with you as social workers in practice. I'm here to define what public health is and demonstrate public health social work in practice. And then of course, get some thoughts from you as well, because I'm still here, still new, relatively new to the practice. And I'm sure a lot of you out there have worlds of experience that I can learn from as well. But these are just a few of my own experiences that I'd love to share with you. So first off, I'd love to, let's see, get a little bit more information about you. So if you could type into the Q&A section where you work, a little bit of a description about what you do, just to get an idea of who I'm really speaking with, that would be great. And of course, connect a little bit further on that. Okay. So again, to go a little further about me, as Dr. Congress had mentioned, I am the manager of behavioral health integration at Mount Sinai Health System in the Population Health Department. And I'll talk briefly about that a little bit later. I was also a co-author of Beyond HIV/AIDS Stigma, a global overview with focus on sub-Saharan Africa. And I also serve as the director of operations for the New York Stranger Sports Organization, which is located in Chinatown. And I'll briefly discuss that as well later in the conversation. Okay. So what is public health? So public health promotes and protects the health of people in the communities where they live, learn, work, and play. And it minimizes risk, giving everyone the chance to live long, healthy, and fulfilling lives. So how is it that we see ourselves interacting with this? Generally, health is often viewed linearly. For example, when you get sick or feel sick, you would go to the doctor, look for a prescription of meds or regimen, and continue on. Doctors and nurses focus on the interventions and treating the sick and injured. Public health professionals aim to target the reasons why and promoting healthy lifestyles through researching disease and injury prevention, detecting and promoting healthy lifestyles, responding to infectious diseases, and we want to reduce the need to see the doctor and increase the time enjoying life. So why a public health perspective? Social workers in the medical field have expertise in promoting healthy lifestyles by providing education, assisting with connecting them to proper resources, and there's a lot of care planning to ensure the basic needs are met. Social workers meet patients where they're at and can address immediate needs that may hinder safe discharge, community, and safety planning. Of course, a lot of that work in the healthcare field, like if you're an inpatient social worker or if you're working in the community, has a lot to do with addressing needs that, as Dr. Begg said as well, a lot of the social determinants of health, addressing those needs and that primary focus. Social workers are also in the community working in agencies and work to enhance community lives. And a few examples prevalent to us today would be COVID-19, HIV, and diabetes, to name a few. And through research and development, we have come to know best practices and procedures to manage disease, create programs, and provide impactful care. Organizations have been growing and learning how to directly support patients and people living with chronic diseases, food insecurity, and shelter programs, and safe places for people to go when they have no other places. And that's where social workers really interact with the public health spectrum. One thing that Dr. Begg had really honed in on was that fork in the road that we have to choose from when public health and social work. And as someone who's gone through the public health social work together and integrated that as a practice as a whole, I do see that straightforward road, that each road in that fork would end up intertwining at some point anyway. So really focusing on how that would work together is really the pinnacle of public health social work. So here are some ways that public health is promoted, and I see social work as generally hitting in a few sections like health promotion, communication, emergency preparedness, environmental health. So those are some of the ways that social workers that I see in the medical field have really intervened and have made most impact in a patient's life. So why the public health perspective? Again, as social workers, we aim to promote healthy lives and address barriers that are affecting a person's ability to live life fully. And here's a nice image from the American Public Health Association. public health is integral to our mission of transforming lives and healthcare through education, research, innovation, and service across the hemisphere. So to talk briefly about some of the things that I've done in the past and what I'm currently doing. Previously, I worked at an organization called GMHC, which as the world's first HIV/AIDS service organization, GMHC is working to end the AIDS epidemic and uplift the lives of all affected people. And some of the programs that they have right now are an Article 31 and an Article 32 clinic. And as if you don't know that already, Article 31 deals with mental health and Article 32 deals with substance use. They have a workforce development program, which I worked closely with, which helped reduce the stigma and barriers for patients and people who are looking for jobs who are living with HIV to gain equitable access to whether it's the interview, getting them ready for that interview. I'm working to get them to that next step where they can live fully. They also developed a buddy program, which was the pinnacle program for their agency in the height of the AIDS epidemic, where they set up a call system to really provide that social interaction for those going through the illness, and isolation was a major thing. And as social workers, that's huge for people to interact with others, providing that companionship and ultimately reduce the suicidality rate that comes with isolation and living with a chronic illness, that people at that time were so fearful that you were ostracized from communities. And they also have a meal service program that offered meals and a chance for people to come together, eat a meal with others. And also, if you are unable to go to the program, you're able to access meals at home through that delivery service. And next, currently, I work at Mount Sinai Health Partners specifically. So Mount Sinai Health Partners, we see our patients as people and design our system of care to make it easy for people to engage in their health so they can focus on living their lives. Integrated health care that works with primary care physicians to deliver high quality, rooted in best practices of current evidence-based medicines. And some of those departments are with behavioral health, the department that I work in, and then the clinical pharmacy team. So Mount Sinai really takes pride in an interdisciplinary team and working together with the physicians and the patients in all aspects. And social work is one of those main aspects. They've taken the route of embedding social workers even in the primary care space to address needs, because ultimately, when you're going to the doctor, there are other things that are causing issues for you that may not be outside of the medical field. And social workers are there then to address those needs. You have patients who are coming in who are saying that they are having difficulties with managing their diabetes, but they don't have access to healthy foods. They don't have access, or they're unable to cook healthy meals because they don't have the resources to do so. They may also be fighting some sort of depression or mental health illness that would be causing more strain on them to live and access the care that they need or requesting help. And that's something that, as what I previously did was an embedded social worker, working on with those patients, those specific things. Currently, in my role as the manager of behavioral health integration, I work with patients and practices to embed a psychologist and embed behavioral health in the primary care space to reduce the wait time and the gap time for a patient to get the services and mental health care that they desperately need. As we all know, COVID-19 happened and that caused a huge strain on everyone's mental health, and access to care was a huge issue for anyone working in the space here, and especially for the patients who may not be able to navigate it on their own. So what I do right now is working with primary care doctors to integrate mental health into their spaces and alleviate the stress that for patients that are looking for mental health maybe in an acute crisis situation, and really working with them to connect them to the services that they need. Now, Mount Sinai as a whole has been working on these things for quite some time now, so I don't take any credit for that specifically, but I'm very proud of the job that I do in integrating the public health and utilizing my work as a primary care, working with someone primarily and in the direct care space and influencing my work now in a more macro level. So I thank you for your time, and I will turn it back over to Dr. Congress.
I'm still muted and hidden. Okay. Thank you, Nicholas. And it's so true about the way social work and public health are integrated. And one big difference I see is really in terms of prevention. And I think in the public health social work, you really introduce that. And I think traditionally in social work, we kind of dealt with people with problems, and we kind of got almost kind of last stage. But one thing about having a public health perspective, we're really into prevention. Certainly as social workers, we work with people in, let's say, a clinic treating people with diabetes, but also we work on prevention in terms of people having healthy diets. And I think you gave like an example of that, really helping, people like develop diets that will keep them well and will prevent them from having like a real problem with their diabetes. And I think that's bringing kind of a public health perspective, into social work. So anyway, both of our speakers were wonderful. What questions and thoughts do you have? And the floor is open.
So I'm Pat Kolb, the co-chair of the social work section, and I'm going to be facilitating the discussion with Elaine. And I see that one of our steering committee members, Allison Snow, would like to know if Nicholas could talk about the Stranger Sports Organization.
Sure, of course. So the New York Stranger Sports Organization is an organization that's run out of Chinatown right now. And our goal is to bring youth recreation to areas that are unable to access that kind of access that kind of service. So as you may know, recreation and youth sports has been kind of crushed by the COVID-19 pandemic. It's been an issue for people to get adequate physical health. And it really starts in youth development, the access to care. So what we do as an organization is we started and founded as a volleyball organization. It's in the Asian community. And we noticed that Chinatown specifically has limited resources to after-school programming and competitive sports that are one, accessible for families that have limited income and resources. And two, with spacing in Chinatown, there's a limited ability for people to access certain or be engaged in certain sports that they may be interested in. And volleyball is one of those things that I'm passionate about, and we're passionate about as an organization, that we try to promote, because it's ultimately a team building sport. It promotes leadership, it promotes competitive natures, and really builds on the physical aspects of youth. So we've worked with middle schools and high schools to bring about these clinics in that local area, and we offer it now we have about 4 clinics that run for the advanced and the beginners age, beginners and intermediate levels, ages 8 to 15. And it's really an opportunity for kids to access and learn about volleyball and gain some kind of community with others who may not have previously. So thank you for that question.
That's really integrates a public health approach. Social work, we're interested, in helping people and helping youth and in an area, feel good about themselves. But also there's a real physical health component. I mean, having, and as you said, with COVID, people became very homebound. So this gives them a chance to kind of go out and be physically active. And so it's really important in terms of preventing them from having future illnesses as they grow older. It's also important in addressing mental health concerns, so that less likely to feel, depressed and anxious, that and that they just can't participate. So that was a good idea. Does anyone else have a question? I mean, I have a question for Melissa.
Excuse me, Elaine. There is a question from
sure, go
Richard
ahead.
Siegel in the Q&A. Should we first do that?
Sure, yes, please do that.
How do you think public health and social work can do a better job of reinforcing community responsibility? Getting the COVID vaccine was needed for the individual and vulnerable family members and the community at large. Instead of seeing things that way, many took some powers away from local public health officials. Would either of you like to respond to that?
Sure, I can take a stab at it first. I think it's a really crucial question. And over the last couple of years, we've really gotten to see the disadvantages of folks not. It goes back to that question at the end, right? What do we owe one another, I think. And trust is at all-time lows, right? Currently. And there's almost an assumption from the start in the environment, political and otherwise, that of ill intention rather than good intention from the get-go. And I'm not sure how to get around that, but I think that's where we need to focus. And we have to encourage building empathy, which I think we can do in social work and public health programs. I think students come to those programs with, with sort of a built-in compassion, but they need greater skills to act on that compassion and bring that to the fore with the skill sets that they develop here. And so I think, there are examples. I have a colleague here, Courtney Cockburn, who's developed a virtual reality experience of racism, where you embody first of all, a Black male child, and then as a teenager, and then as an adult. And she's measuring how that builds sensitivity and empathy for the experience of racism, no matter what your demographic is. It's an incredibly powerful and visceral experience. But I think building things like that into training programs, again, I think that students who are drawn to social work and public health have a higher level of compassion to begin with, but we can all improve from where we are. And I think that building that empathy is the solution to that, is part of the solution to that community responsibility question.
Yeah. Okay, and I think we have thank you.
Thank you.
We have another question for the audience. Well, from Judy Dobra. What are thoughts about how to encourage physicians once they're finished training and hopefully they've learned about interdisciplinary collaboration in their training, but how can we encourage them to continue to collaborate with social workers after they graduate and they're out working? Well, folks.
Again, Nicholas, I don't know what you want to say. I think I've worked on a lot of training programs for physicians as well. And I think this interdisciplinary exposure and collaboration during the training period is helpful. I think we need more joint programs, perhaps. And, I hear this from my daughter, the social worker. There are some physicians in her unit that interact with social work a lot and some who simply don't. And so we have to get the word out. We have to be more present at the table, and social work needs a seat at the table in order to make that happen. I don't know how you find it at Mount Sinai, Nicholas.
No, I definitely agree, and I appreciate the question, Judy. I firmly believe that social workers should be at the table with the physicians, especially in the care planning for patients, when oftentimes the patients are coming into the medical office to be treated. The underlying fact is that there may be something else involved, and it's important to understand that social workers, other care physicians are able to help manage and fully see that patient, but you have to look past what it is that you're presenting here medically, because there are other issues that are coming in, and it's important that again, as Dr. Bragg had said, really underscoring that social workers need to be present and have that ability to voice their expertise in these matters as well.
Thank you. Fred Friedman has said, I think sports is a wonderful way to market services to people who might not otherwise access programs and services. What other avenues do you use, or are you planning to market and make your services available in vulnerable communities? And I just want to add that that program makes me think of the Midnight Basketball program in Chicago that was developed many years ago. That was very successful in terms of engaging kids in the community who had nothing else to do at midnight and became engaged through sports. So Nicholas, do you want to respond in terms of, are you planning other ways?
There are a lot of things in the works right now. We're still in the pilot and planning phases for different things, but our hope is to really grow in the community to incorporate more services that are obviously in Chinatown specifically. There's a lot of vulnerable people there, especially the elderly as well. So we're looking to grow our organization services. So thank you for that question.
That's terrific. I just noted that earlier in the program, Terry Miskwaki had indicated that she wanted to acknowledge the late Barbara Brenner. Would you like to do that now, Terry? If Terry's still here. Maybe she's
Maybe
not.
she's
Well,
gone.
Elaine,
Okay, I'll ask her. I'll ask her. Okay, but maybe I'll ask her.
Yeah,
Oh,
so
oh.
she cannot do that. She doesn't have the option of saying anything other than through the Q&A.
Oh, okay. Well, she writes something in Q&A. We can kind of read it all. I just wanted to relate to an important, point that Carolyn Messer raised, which I've often thought about. I'm really kind of concerned about why people were so late to believe in taking the COVID vaccine. I'm sure the people that I associate with really gun ho, but then I heard some people who really were going to move ahead with it. And Carolyn points out, this is really different with the Salk vaccine. Everyone rushed in to get their children immunized, against polio. So it's really interesting to think, and I guess maybe that's a question for you, Melissa, about why this has changed. I mean, if anything, we need science more to help us deal with, with these, pandemics that seem to be happening.
Right. Yeah, I think it's a great point. Thank you, Carolyn. And I think what we see is an epidemic of misinformation, and the fact that misinformation and disinformation have actually been weaponized, right, and amplified through social media. And I think that is in order to preserve status quo, and who's in more dominant positions and who isn't. And racism and classism really have come to the fore with COVID-19 as well, not just in terms of who got sick more, but who kept the country going in those early days when everything was shutting down. And so I think in addition to programs that focus on building empathy, programs that focus on building critical thinking skills. And I think we tend to think of empathy and critical thinking as sort of innate traits. And I don't think that's necessarily the case, or at least we each have a certain ability, but anybody's ability can be enhanced. And perhaps a greater focus on that, not just in social work and public health programs, but going back into high school, so that people are able to navigate misinformation. I teach intro to stats for social workers now, you won't be surprised. But I changed the course for the first time. I included something about what are some tools you can use to figure out what you read on the internet, what's accurate and what isn't.
That's a very
never
important.
thought about that before. This is the first time I've ever done that. But I think it's really critical.
Yeah, a lot of people kind of struggle, struggle with that issue. So I'm really glad that you're doing that. It's such an important issue, deciding what's what's just terrible propaganda and what really, like makes sense. And it's so important to listen to the scientists, but unfortunately many don't. Now, so, well, I don't want to end on a kind of a negative note, but I think I'm definitely on the right track in terms of how to, combine public health and social work and predict, what's your prediction in the future? I mean, do you think we're going to move closer together?
I certainly believe it. I think we have so many, again, these big world events are here. They are nipping at our heels, and they are unavoidable, and we have the tools and the ability, I think, to overcome that. Nicholas, what do you think?
I really hope so in the end. I mean, as I totally agree with you, there has been so much that has happened. There's only one way that I see moving forward with these things, and that's really combining what we do and like seeing a person, but understanding where they're coming from and really trying to meet them where they're at with the education that we have and the knowledge that we have and really providing that for people. But I can only hope at this point that we're going to move towards something that really mixes the two, but also respects where we're at in the systems.
Right. Yeah, well, thank you. And also, we're going to have to close, but I just want to say what Terry Mizrahi spoke about with Barbara Brenner. She was a great collaborator, kind of bringing different programs together. And we see this in our public health social work program and what we've done here and what we're going to be continuing to do in the future. I want to thank you all for coming and participating. Please keep in touch. You know how to contact our speakers. You can always contact me, congress@fordham.edu, and contact NYAM. We really, look forward to continuing this conversation. I really want to thank Donna, for hosting us, and Joey for helping us with the IT. And, stay tuned with our social work section, because we're going to be putting on other programs, and which will be of interest. But I think this is great, and I'm glad that we can participate in this anniversary event for NYAM. It's really important, the program that we've done on public health. Thank you.
Thank you to our speakers, and thanks to everybody who attended.
Great.
Thanks, everyone. Have a good night.
Thanks,
Be
Donna.
well.
Thank you.
Bye-bye.